Hey, welcome back to Feel Fluent in English. Today, we need to talk about a really critical issue. In Nigeria, a concerning trend is growing where more and more people are turning to herbal remedies instead of visiting doctors or taking modern medicines. But here is the real twist. The driving force behind this isn't just tradition, it's technology. These remedies are being promoted online through social media algorithms, which are the computer systems that decide exactly what content you see on your feed. It turns out that when it comes to healthcare, this technology is actually making people less safe, not safer. To understand how this happens, let's look at a term experts are using: the algorithmic apothecary. Now, an apothecary is just an old-fashioned word for someone who sells medicines or herbs. The algorithmic part refers to how social media platforms work. These systems are designed to show you more of the content you already like and watch. So, if you watch just one video about herbal medicine, the algorithm will feed you more and more of them. Before you know it, you're trapped in a filter bubble where you only see the same kind of information over and over again. And that brings us to the real health risk. The danger here is that many of the herbal cures promoted online have never been scientifically tested or proven safe. While some are completely harmless, others can be genuinely dangerous, especially for people dealing with serious illnesses like cancer or diabetes. When someone with a serious condition relies on a false online remedy, instead of getting real medical treatment, their condition can get much worse. This isn't just an individual problem anymore. It has become a major public health crisis. What makes this so complex is that misinformation spreads much faster than the truth on social media. A video claiming a particular herb cures a disease might reach millions of people within days. Meanwhile, a scientific study proving that the herb doesn't work might only ever be read by doctors and researchers. Remember, the algorithm doesn't care about accuracy. It only cares about engagement, which means clicks, views, and shares. There's also a massive financial side to this. The people who post these herbal remedy videos often make money directly from advertising revenue. The more views they get, the more money they earn. This creates a huge financial incentive to make extreme claims and promise miraculous cures, whether they're true or not. Some creators are deliberately spreading health misinformation simply because it's highly profitable. In Nigeria specifically, this problem is amplified because quality healthcare is often difficult to access. Hospitals can be far away, expensive, or under-resourced. When people feel desperate about their health and have limited options, they become much more vulnerable to believing false promises online. They trust what they see on their screens because they feel like they have no other choice. Now, we also have to respect the cultural context here. Nigeria has an incredibly rich history of traditional medicine that people respect and value. Many traditional remedies are genuinely beneficial and have been used safely for centuries. The real danger only emerges when these traditional practices are mixed with false modern claims online, or when people abandon proven medical treatments to rely entirely on unproven alternatives. There's a massive difference between complementary medicine, which works alongside modern treatments, and alternative medicine, which tries to replace modern medicine entirely. So, what can be done? Solving this requires effort from every direction. Social media platforms need to take more responsibility for the health misinformation on their services. Healthcare workers need to communicate better with their communities, explaining the importance of modern medicine while still respecting traditional knowledge. Education is also key. People need to learn how to spot reliable health facts online and understand how algorithms manipulate what they see. Finally, governments must work to make quality healthcare more accessible and affordable. When people have real, affordable access to proper medical services, they won't have to turn to risky, unproven remedies out of desperation. At the end of the day, this situation reminds us that technology itself isn't inherently good or bad. What matters enormously is how it's used. The exact same algorithms that spread health misinformation can also be used to share life-saving medical knowledge. The same internet that promotes false cures can connect people with legitimate healthcare. Given everything we've discussed about how algorithms spread health misinformation, what do you think individual users can do to protect themselves and their loved ones from believing false medical claims online? Let me know in the comments, and I'll see you in the next video.